Okay, does it seem like your kids bring home more germs than homework? It is miserable to see your kids sick. So here with advice on how to handle all of the bugs, we welcome back the author of Doing It All, Pediatrician Dr. Whitney Casares. So good to see you.
Nice to see you.
Thanks for stopping by.
Yeah.
This is the season. I feel like the coughing and the sneezing has begun.
Yes, it's going to start in the next couple months, and a lot of times people seem surprised that their kids get sick, but just remember, germs like to congregate, so the more that we are inside together with our fellow little friends at school, the more that we're going to get sick, and that's a normal part of childhood, but we can prevent a lot of it and hopefully not overtreat things.
Exactly. Okay, so let's talk about croup first, because this is still something that we need to be aware of.
So croup is from a virus, and it can cause this kind of barky seal-like cough. It sounds very, very loud and abrupt.
It's very sad.
It's very, very sad. My little one used to get croup all the time when she was little, and it really causes kind of a swelling here in the neck region, inside, not of the neck itself, and it can make kids so that they can just sound bad, but often it can make it so they have trouble breathing. So really, the first step if your child has a barky cough is to get them either into a warm, steamy shower. That's going to help to decrease that swelling, that inflammation, or get them outside into the cool night air. That's step one. And then start to look to see, is my child having any distress with their breathing? That's the thing as a pediatrician that I'm looking for the most. And distress, I always describe that as it looks like your kid just ran a marathon. So they're like, really huffing and puffing, can't get it together. If that happens, please call for help, 911, if they are having a true respiratory emergency. And if you're in between and you're not sure, please call us as pediatricians. We're well versed at figuring out what should be the next steps.
Yeah, always err on the side of caution, especially when it comes to something with breathing that can be so scary. Okay, let's talk about strep throat, how to kind of differentiate between just a regular old run-down kid with a sore throat.
Yeah, so strep throat, which is caused by a bacteria, streptococcus, and viruses that cause sore throats actually can look very similar. For both, you can have a high fever, you can have swelling or pain in the throat, you can have white spots. So really the best way to determine is this strep or is it not is with a test. And I hate the nasty swab on the back of the throat.
Awful.
It's so terrible, but you really do want to test for it and only treat if that swab is positive. Because if it's just a virus, which can be miserable, but if it's just a virus, it's gonna just give you diarrhea and all kinds of antibiotic resistance if you start a kid on an antibiotic. If it is strep, we actually wanna treat it because we know that strep can affect other things for certain kids and certain people. So that's why we actually treat it with antibiotics. So it can affect the kidneys, it can affect the heart. So it's one that we actually want to make sure that it goes away for people when they get it.
You don't wanna mess around with that. And have people been getting more recurring strep? I feel like I've heard that happen quite often recently.
Well, there are certain people who do tend to get strep more often. I always explain it like there's certain people with their anatomy, they maybe get more ear infections, or certain people like myself, they get more sinus infections. And there are definitely folks who tend to get strep over and over and over again. If you complete your course of antibiotics for your strep and then it feels like it comes back, of course, go back because we can do additional treatments. But we always want to make sure that we aren't testing people for strep when they don't have symptoms, because there are some people who are what we call strep carriers. And that just means they've had strep, and so they're just going to test positive for strep all the time. So again, please listen to your pediatrician's advice about when's the right time to have treatment.
And don't forget to throw away your toothbrush, because I've made that mistake before.
Yes, so you want to throw away your toothbrush after 24 hours of starting on the antibiotics, and make sure not to share liquids, cups with other people. And also, you really do need to stay home from school and from work for 24 hours.
So contagious.
Yes, very contagious.
But the antibiotics, they do work that quickly. So just a day, and then you can kind of carry on, right?
Yeah, you're going to keep on going on the antibiotics, but in terms of the contagiousness, that's good in 24 hours. You might not feel better for 72 hours. So treating with ibuprofen if you're over 6 months old, and or Tylenol, those are great ways to help you feel a little better. And then also those warm, soothing fluids or cool fluids like a popsicle.
Okay, let's talk about common cold versus maybe something like the flu, another thing that can have kind of confusing symptoms.
Yeah, absolutely. So colds, they just tend to be a bit more mild. You're gonna get that stuffy nose, you're gonna get a little bit of cough, you might have a sore throat associated with it, and usually you don't have too many troubles in terms of breathing, muscle aches, that type of thing. Influenza virus generally speaking, it knocks people out.
Yeah.
So you feel like you just got hit by a truck, horrible muscle aches for a lot of people, headaches, and generally speaking, a higher fever that tends to last for a longer period of time. We don't always have to test for the flu, but I like testing for the flu in situations where I'm worried like, ooh, this fever is lasting for a lot longer than I thought it would, or, ooh, this person looks really, really sick. Or if we're trying to differentiate between should we start treatment or not. Most people actually don't need antiviral medication for the flu if they're a person who doesn't have any coexisting features.
Okay.
But some people like who are under 2 years old or who have issues with asthma, heart conditions, that type of thing, a lot of times we'll start them on treatment for the flu.
And then what about if you do have a common cold, some secondary things that can kind of pile on and become more serious?
Yeah, absolutely. So the more mucus, the more congestion that you have from that cold virus, it can back up into different areas. For the young kids, especially kids who are in daycare settings, we tend to see it back up into the ears a lot. That's because the anatomy is a bit different for kids than adults. So in kids, I always talk about the anatomy of the tube between the nose and the ear being a little bit more horizontal, and then for us, it's more more vertical, and we could blow our noses more easily.
Sure.
So a lot of times it backs up into the ears. You're gonna see, if there's an ear infection, generally speaking, really bad ear pain and high fever, kind of after that cold already set in. A couple days later, like a week later. The other thing that can happen from general colds is pneumonia. It can settle into your lungs. So warm fluids are going to help to melt the snot, not to be gross, but that is the thing, melt the snot. Nasal saline mist, that's always my favorite.
Oh, okay.
Yeah, so it comes in like a liquid. You could squirt up your nose, or you can do the mist, which gives a nice little spray that's usually more tolerable, and it's going to make it so then again, you can kind of dry out those nasal passages.
And we always have to remind people how important it is to get your flu shot.
Please.
Please.
Please, please,
For all of us.
Yes, get your flu shot. That's going to protect the people in our community who can't get it or who are really vulnerable. Helps with what's called herd immunity. And then also wash your hands and cover that cough. Please, please, please.
All the simple things that you learned in kindergarten, they still help so much. Great to see you.
Good to see you
Thank you
too.
so much.
Of course.
We'll have more about Dr. Whitney. Her book, again, is Doing It All. We'll have all that on our website at katu.com. We'll be right back with more Afternoon Live right after this.